have the honor and privilege of interviewing Dr. Jen Nash, who is a physical therapist and a fall prevention specialist. Welcome, Dr. Nash. Thank you so much for being here.
Thank you for having me.
So I was wondering if you could just kick us off with telling us what questions someone could ask themselves to know whether or not they're actually at risk for falls.
Yes, it'd be my pleasure. First thing you should ask yourself is, have you fallen in the last year? If you have, then you are at increased risk of falling again. You're more likely to have another fall. If you worry about falling, that indicates that you could have some balance deficits. Another question to ask is, do you feel unsteady when you're standing or walking? Again, that's indicating there might be some problems with their balance.
Okay, so if I'm asking myself those questions and I answer yes to just one of them, does that mean I'm at fall risk, or do I have to answer yes to all three?
Yes to any one or all of those questions means we should assess further.
Okay, so in talking about assessing further, can you expand on that a little bit more? What does that mean for someone who's answering those questions? What should they do next?
Yeah. Well, what we would like you to do is, one, find a fall risk screening in your area. In September is a great time to find fall risk screenings because it is National Fall Prevention Awareness Month. And so several communities across the United States will be sponsoring fall risk screenings. But what if this isn't September?
Mm-hmm.
What if September's a long way off? What should you do, right?
Exactly.
Couple things we want you to think about. Your physical therapist is a great person to go to because we want to understand your strength level in your legs, your balance, and your walking. We want that professionally looked at. And to be able to understand where deficits are and work on those, that physical therapist would be a great person. Another thing a physical therapist can do is talk with you about your home environment. There's several home hazards that we can alert you to, such as throw rugs, right, or slippery bathroom floors, that we would want you to take care of to decrease, that risk for falling.
Okay, so physical therapist, great starting point, as I always recommend on my channel here. So what about other providers, though? Is physical therapy the only place people can go to help prevent falls?
No. I'd recommend they also talk to their primary care provider. There's several things to talk to them about. Number one would be talking about the medications that they take. Medications have side effects, and the more medications you take, the more side effects that can come about. Specifically, feeling dizziness is a huge side effect for medication. Also feeling tired, or fatigued. And both of those can really make a person have a more higher risk of falling, just by stumbles or being just a bit too groggy to lift up their feet properly, right? Another thing to talk to your doctor about is your vitamin D levels. Have your vitamin D levels checked. If you're deficient, a supplementation could be important because we have linked vitamin D deficits and falls. Also, for someone that has low blood pressure, sometimes people are told they have orthostatic hypotension, which means that they have low blood pressure. And when they stand up or when they get out of bed, they get dizzy, feel lightheaded, maybe like they want to pass out. That is a huge concern for someone who's at fall risk. Or even it might be causing that worrisomeness that they might fall, right?
Absolutely.
So we want you to let your primary care doctor know that you're having those symptoms so that they can work with you on medications, maybe just managing how much water you drink a day. There's several different factors to talk about when you're having that low blood pressure. And then I would recommend they also follow up with their eye doctor. It's really important to have yearly eye exams. We want you wearing the correct lenses so that you are seeing clearly when you're walking up and around, whether it be in the home or in the community. And we also really like older adults to stay in single lenses. Oftentimes we get that multifocal or progressive lens or even a bifocal, and that can change our depth perception. As we age, we actually have a change to our depth perception anyways, along with our visual acuity or how well we see. And all of those factors can combine together and really increase our risk for falling, because we're not seeing where that curb is or where that step is, as clearly as we could with that multifocal or bifocal lens. So we want them to be wearing single focal lenses and ones that are up to date in prescription.
Okay. So seeing your physical therapist, seeing your primary care, as well as your eye doctor are all really important for help preventing falls. Also, as you talked about in the month of September, it's Fall Prevention Awareness Month, and so there are a lot of screenings happening in areas near you. So there's going to be links on the seniorcenteredpt.com, so you can type in your area code and you can find your closest screen from a physical therapist or maybe physical therapy school or maybe occupational therapist. So make sure to check that out. So Dr. Nash, in addition to the individuals that have answered yes, there's also the individuals that have probably answered no to all those questions, and they might think, phew, I'm never gonna fall. I'm not at fall risk. Is that true?
Well, I would love to say that's true, but the statistics tell us otherwise. So over the age of 65, 1 in 3 of these older adults will fall each year. And your risk factors can really change, right? Your vision can, start to bother you. You can be taking more medication. You can begin to have, maybe you've even gotten sick. Maybe COVID has gotten you down for a while, and so you've lost some leg strength, right? So at any point, we really have to be mindful of if you're falling, or if you're feeling like you could fall, you're being fearful of falling, that you are getting assessed, right? On top of that, I do recommend that you think about a vitamin D supplement. Okay, if you're under the age of 70, we recommend 15 micrograms. If you're over the age of 70, we bump that up to 20 micrograms of vitamin D. Another way to get vitamin D is make sure that you're out in the sunshine, right? Our bodies make vitamin D from sunshine. So if it's in the summer months, try to go outside for 10 to 15 minutes. In the winter months, we have to bump that up to about 20 or 30 minutes. But please remember not to go in the hottest part of the day, right? You can go earlier in the morning or later in the afternoon and still get that sunlight that is going to give your body the chance to make vitamin D, okay? And don't forget, you can't wear sunscreen when you're
Really?
not during those times, because otherwise that prevents those rays from coming into our skin.
Okay. So when we're thinking about getting those rays into the skin, do I need to wear a tank top or certain clothing, or is it just being outside in general, even if I'm bundled up in my winter jacket?
We want you to have about 15% of your body exposed. And what that means is that your face, your hands, your arms are exposed, or maybe your legs. That's enough to get that vitamin D you need.
Excellent. Well, Dr. Nash, thank you so much. We really appreciate your time and expertise. Is there anything else that you would like to share with our audience about fall prevention?
Yeah, I think one other tip that I'd like you to be thinking about is what shoes you wear. Our footwear is so important. It can definitely cause falls, right? So you want to have a good sole. One with a bit of traction is most preferred. You want to have the shoe cover your foot, including your heel. So a nice grip around your heel, some room in your toe box, right? So that you are able to take a good step. And you want one that actually flexes where your toe bends, right? So if you should be able to bend that shoe, it shouldn't be so rigid that you can't, okay? And then the last thing I think that I'd like you all to think about is a couple comorbidities or other things that you might have going on that would indicate you are a fall risk. So those that have osteoporosis, and those that have depression. Those two are good examples of someone that should get that assessment by a physical therapist and should have the conversations with your doctor about falls.
Excellent. Also, for those who answered the 3 questions and maybe they feel like they want a little bit more information, can you tell us a little bit about the Stay Independent questionnaire?
Yes, it is a great questionnaire that is on the NCOA, or the National Council on Aging's website, and it goes through 12 questions, and you just answer yes or no. And it will tell you not only your score at the end, but it will also tell you why it's asking those questions. And so that's very informative. It leads you to understand why having poor balance is an issue, why having weak leg muscles is an issue. It talks about having to rush to the bathroom. That's a concern about when we're talking about falls, as well as other medications you might take. So take a look at that website, go through that survey, and it will email you back your results, which is a nice thing to be able to take to your doctor or your physical therapist when you go.
Excellent. And we will link to this website right here, also in the show notes, so make sure you check that out. Dr. Nash, thank you so much once again. We really appreciate all that you've been able to provide our audience. I know it's going to help prevent many falls, so thank you.
Thanks for having me, Dr. Katie.
Until next time, I'm Dr. Katie, the Senior-Centered Physical Therapist. Have the strength to live life to the fullest. Bye-bye.